Okay, hey everybody. So I wanted to bring on my very good friend. He is a surgeon in a hospital, in a couple hospitals, right? Very close to New York City. And I apologize in advance. I'm on a construction site right now, so you hear some of that. But I thought it was imperative to bring you on immediately because you know what's going on. So please introduce yourself to everybody.
Okay, so my name is Kieran Parekh. I do foot and ankle surgery. I'm a podiatrist up in North Jersey, and I work in a multi-specialty group with a bunch of different physicians, including internal medicine, GI rheumatology, and a few cardiovascular surgeons. And I do their lower extremity foot and ankle surgery. I'm on staff at 3 different hospitals near New York City and North Jersey.
Amazing. So really the biggest question I think that I have, because I haven't been to a hospital in a long time, I'm actually hearing not to go, but what are they looking like right now? What is it like going to work every day at the hospital?
Yeah, so I stopped seeing clinic patients. I do like online televisits, but I do have hospitals inpatient, which means in the hospital for gangrene and other like lower extremity injuries. And I round on them, so I see them every day. So I see what's going on the floors and how things are being sectioned off and through the ER. And right now things are kind of dangerous. We're running out of room for patients. The hospitals that I'm on staff at are calling for people in other specialties to come in and help because everyone's overwhelmed by COVID-19 and influx of patients.
Wow. Oh my gosh. Yeah. Of course, this is affecting everybody in all these
Yeah.
different ways, but especially for you, I'm sure that every day that you go into work, is giving you some anxiety in some way, right?
I'm not frontline yet, but I start my shift next week in the ER, and I'm sure I'll be seeing a lot of what's going on in the news and all that stuff. But as far as anxiety goes, I wear a mask to work every day. And I follow good hygiene and the CDC recommendations, so those are okay. But the anxiety is seen in everyone I'm working with because they work in the hospital every day. I'm just between hospitals and my clinic. So the nursing staff that's frontline, the ER doctors, the internists, the hospitalists are going room to room doing physical exams. You can see the pressure that they're facing.
Wow.
Which,
Yeah, well, I wanted to ask you, so you're a foot and ankle surgeon, but they have you now, what you say, it sounds like almost like battle, like you're going to the front line.
yeah, it's straight up war status. Yeah. So the hospital I work for, it's a great hospital. I'm on staff. I did my residency there. It's called Englewood Hospital. And from the beginning, from day one, they did a really good job at informing us. We have conference calls once a week. They've given us all the protective equipment that we need, which is excellent, given the situation. And we've been trained in all these different things. So they called for physicians because they want to provide good care to the patient population, which is inflowing really, really crazy, like 20 to 30 admits of COVID-19 positive patients a day. So you can imagine, along with all the other patients that are sick, that influx is stressing out the entire hospital system. And each hospital system is like its own bubble, trying to take care and manage what's going on the best way they can, given the funds and resources they have.
Well, I want to ask, so are all hospitals, are they doing the same procedures, or every hospital is different, or what is it like?
Yeah, that's a good question. And actually, each hospital system, it seems like it's doing a different protocol, but for the most part, the same thing.
Okay.
And that includes, like, if you look at, there's a website called Up to Date. You'll see I actually posted on my Instagram. They posted like 4 big institutions and their protocols for COVID-19. So Brigham Women's Health, which is Harvard Hospital, has it. Mass General has one. Michigan has one. Nebraska has one. UPenn has one. So for the most part, they're all saying similar things, and that includes the use of malaria drugs, hydroxychloroquine, aka Plaquenil, the use of ventilators, oxygen, different types of labs you want to take, this antiviral drug called remdesivir. I think that's how you pronounce it. Just stuff like that that's kind of in the protocol, but not really completely efficacious or proven yet. They're just like, this is the protocol that we have. There's no cure for COVID-19, but this is what we're doing, and data points are coming in.
Right now, are you seeing improvements in the hospital, or are you just seeing them get more full and more full of COVID-19 patients?
The positive side of this is kind of like what I was getting at previously was data point. We've only been battling this as a country for 2 weeks, right? So data points are coming in pretty, pretty quickly, and these protocols have already been in place based on these institutions that I mentioned. So as time passes, the hope here is that these data points will keep coming in, and we'll be able to form a protocol that works for most patients, or hopefully more than 50% of patients, which would ease the anxiety, mortality, and everything that's going on right now.
Right, of course. So my last question is there anything that you know that we don't know that we should know? If we are feeling sick, are we just advised to completely avoid the hospital, or is it still somewhere that we can safely go, whether it's with COVID-19 or not?
Yeah, so obviously everyone should be staying at home and taking care of themselves at home, and that's dramatically, pretty much, we've canceled all elective cases, which means non-critical cases surgically are not being done in our state or New York, and which is lowering everything. Like, people aren't driving, society's at a pause, people aren't getting injured, crime is low, so all these things are pretty much eliminating a lot of the hospital influx. But if you are sick, there's a threshold you want to kind of weigh, and that threshold would be, if you have fever for a few days, or if you're feeling actually very sick, then go to the hospital to get tested. But the issue right now is that you get tested and you're positive, we won't know for 5 to 7 days because there's no rapid test yet. We're sending out swabs out of the lab. Hopefully we're getting it this week and next week. The Abbott Laboratories rapid test kit that they're sending out. Our hospital will be getting it soon. But if you're young, otherwise healthy with no comorbidities, which would include diabetes or other underlying diseases, staying at home, hydrating, taking anti-fever medication like acetaminophen. Ibuprofen and NSAIDs are not recommended. Or some institutions are saying they're not recommended. Some institutions are saying they're okay, but I would just not take them. I would just take Tylenol instead. Boosting your immune system. So the time to get sick isn't now. If you do get sick, if this spreads like it's supposed to, then most of us will have it at one point or another. But time is not to get it now because everything is in flux. We have no protocol for treatment.
Right.
And vaccine is a year away still. So what things that you might want to know or don't know yet, just overhydrate your body, make sure you're getting well hydrated, sleep really well, keep your immune system at peak performance while you're staying at home so that you can fight this off if you have it or if you get exposed to it. And staying away from even your family members, like keeping your distance. And people are leaving in and out to at least go to the grocery store, and there's anxiety there too, but people will be fine if they take care of themselves.
Amazing. Well, thank you so much. I think this was really informative to everybody and helped shed some light on what you're going through as a doctor. And I can't believe that you are a foot and ankle surgeon, and now you are going to be in the ER admitting patients.
I'll be in the ER admitting patients, doing everything.
Wow.
And all of the surgeons feel that way. Like, there's a general surgeon who's like, I haven't done, was it lung sounds or breath sounds in a while. I don't know what the hell to look for. And he was like kind of making fun of it. But we're all like ready to go. It's we have to be in the moment right now. It's weird to say, but we don't really feel much anxiety because we kind of are in the hospital every day. We see this every day.
Right.
We don't, it's an invisible enemy. So we don't perceive this to be a fearful thing. We're like, we're just going to work tomorrow. We're just doing the same thing we do every day, right? Going to the hospital, wherever, just different situations. So most of the physicians I've talked to don't really have much anxiety regarding this. They're like excited to work. They're excited to be in the present to help, which is nice.
Yeah, that's wonderful, including yourself. So a huge thank you to you.
Yeah.
Thank you, Health Heroes. And so again, Kurt is, I'm going to tag him here on Instagram, and also he is famous on TikTok. So I hope that everybody starts to follow him. He's got some really good advice on TikTok. So anyway, thanks so much, Kurt.
All right, no problem. Take care. Be safe.
Have a great day.